Welcome everyone to Weird Growth, the podcast where we hear about the strange and often unpredictable journey that founders take. This episode, we have Nic Blair from Midnight Health, which is a digital healthcare platform that offers customers a range of services, including telehealth consultations, home delivery of prescription medicines, skincare treatments, birth control, men's health issues, and precision supplements for gut microbiome. Also under the banner of Hubbed Up Health, I believe, Nic. Mate, incredible what you've achieved in not a very large amount of time. Since 2021, you've grown to over 30,000 customers, I believe. Congratulations on what you've achieved. Thanks so much for being on Weird Growth.
Yeah, thanks for having me. We've actually ticked over 50,000 customers now. We've been on I guess February was our 2-year anniversary. So we've certainly had a pretty fast and furious couple of years, I guess, since we launched the company. So yeah, it's been great. And thanks for having me.
Yeah, no, it's really excited for this chat, especially in this health and telehealth space. Very exciting industry at the moment in Australia in particular. Maybe would you mind introducing yourself and how have you come to do what you do?
So I guess I have personally gone through quite a journey as an entrepreneur, I suppose. Realized quite a few years ago that trying to build things and start something from nothing was something that I really enjoyed. So 2008, 2009, I started a whole bunch of different startups, I suppose, or projects. I don't know if some of them were big enough to be categorized as a startup, but had a whole bunch of failures over those couple of years, but all the lessons that come with that. And so taking those lessons, went and got a job when I finally ran out of money after 2 years of trying to start, a few different online businesses. And then, in 2011, I started a digital agency called Search Factory. And so that one, I guess, ended up having a bit more success than my previous startups. We ended up selling Search Factory to a global media company called Dentsu in 2019. And so that kind of set me up in a great position with experience and all the rest of it to then, I guess, get to the end of that acquisition and earn out for that business. And then go through the process and decide what am I going to do next and end up, launching Midnight Health not long after. So, it's kind of been through a journey wearing the battle scars, as you can imagine, as you go through all those processes and journeys to different businesses. And I guess ultimately it's kind of where I've landed today and what's helped kind of the lead up into launching Midnight Health and getting success with this business.
Wonderful. But isn't that good? You've really lived that entrepreneur's journey of, every step that you take is a lesson and another sort of string in your bow that you take on to the next project that you learn from and improve every time.
Yeah, I think that's really important. And I think people starting businesses don't necessarily approach it like that. And I think if let's say you're an athlete, right, and you're trying to become the best athlete in the world or at some level of success as an athlete, it's like, our expectation is not that you go and win your first game and win every game after that, right? And become a success overnight. It's, I think business is the same. And the more that you go through this process and you learn and you keep iterating on that, you get better over time at it and you learn things every step of the way. And so, in reality, every 12 months you get better, like you would hope to if you were an athlete or, something like that. So I think people should approach it that way.
Well said. I'd love to learn to just dig a little bit more into Search Factory in a sec, if I can. Yeah. But before we get stuck into that, we have a pop quiz that we ask at the start of every Weird Growth episode, which is, in a parallel universe, if you were to start a new business today from scratch, what would it be and who would you be helping?
That's a very interesting question. If I was to say in a parallel universe, what I was to do, what I've always said that I would love to have done, which is not necessarily start a business, but I've always thought, how fantastic would it be to be a lead singer for a band or an artist who stands on a stage in what I could only imagine would be the most surreal experience, to be standing in a stage in front of tens of thousands or hundreds of thousands of people listening to your every word. I've never pursued a career as a singer or anything like that, but I just probably like most people, I look at that and think, wow, imagine what an experience that would be.
So many similarities though with that and being an entrepreneur, to be honest, like, being front man, coming up with the creative vision, and then turning that into a reality, and then taking a 1 in a million chance basically that you may or may not succeed. It's pretty good. Pretty good analogy. That's cool. Thanks, Nic. So If that's okay, because that's personally interesting to me. The Search Factory story, that was a services agency, is that right, for digital services?
Yeah, yeah, that's right. So started kind of in, I guess, early search marketing and those types of areas, and then kind of continued to expand to become more of a full service digital agency over time. But yeah, service-based agency
And
business.
any particular types
yeah.
of clients?
Look, we kind of had quite a mix of clients, clients in travel, people like Flight Centre, Super Amart, other sort of big Australian brands, a lot of e-commerce companies and things like that as well, law firms, accounting firms, stuff like that. So yeah, that's kind of grew with the business as a business kind of had a really good first 5 years to the company, which sort of when we then started ending up in the acquisition discussions.
Well done. And what did that teach you growing a business like that? Because it's very different to a very scalable online software business. Services is a different game, isn't it?
Yeah, well, I mean, interestingly enough, one of the things that it taught me was I got to the end of that and said, look, that was a great, we did well out of it. It was a great, kind of business to sink my teeth into growing something to the size that we did and all the rest of it. But it also taught me that I don't want to start another service-based business. So I think, a service-based business is great because you can start it at low cost. You can, it's great first business or first couple of businesses for someone where you can
be the product yourself.
You are the product. You can sell your time. It costs reality, it probably cost me $600 to set up Search Factory. So, there's a lot of benefits when you start a business like that, but you also realize the limitations of scaling a service-based business, right? And so, from when I got through the end of that, there are a lot of lessons that came with it. How do you build a culture in a business? How do you scale a team? How do you improve the ways of working? What technology do you use to support growth and make things more efficient? There's so many lessons that came out of growing that business, but then it's also helped pave a pathway for what do I want to do next? And, as you said, the scalability is wildly different from a technology-based business versus a service-based business, and you're not just selling time for money, so right. It kind of helped shape where I have ended up after that as well.
Yeah, love that, and gives me a lot of inspiration from that too. Especially working in, Ammo focuses on startups, and a lot of our clients are doing incredible things in that space, and we'd like to think we're part of that culture, but there's always going to be that restraint. The unit economics is the more hours you sell, the more people you need in the team. So it's very linear as opposed to potentially parabolic. But no, how did it feel? How did the acquisition process feel to you? What was that like?
It was really, great. Obviously, we went through, we were acquired, but it also came at a time when we were starting to think that way too, because the reality is that when I first started the business, it was at a time where the people that we were competing with, when we went to pitch for clients, weren't the big agencies. So it was an early stage of digital agencies, digital marketing, where our clients were looking for specialists in those areas. And what happened is that over time, over the 5 years since I started the business through to when we got acquired, we'd start turning up to pitches where we're now competing with your MediaComs and your iProspect and Dentsus and your OMDs and all the big media groups who now all of a sudden were trying to capture the digital budget just like they had the above the line. So we could see that landscape changing. And so from my perspective and our perspective, we're like, there's also a point where you either join the big guys or they take you out. And so, I think there was a right, how do you scale the business from here and find the right timing to get acquired? And I think that was it. And so it happened, and it turned up at the right time where we saw opportunity to drive growth off the back of becoming a part of the big group as opposed to competing with them as the landscape started to change. But it is a pretty cool feeling, and it was a great experience to go through, where you are sitting down and someone's negotiating buying your company that you started from scratch. And it is something that I'll always be grateful for having to have been through as well. I think not everybody gets to go, end up building something that actually someone else sees value in right at the end. So it was certainly a cool experience.
It's pretty special, mate. Yeah, congrats on that. Very cool. Well, moving over to Midnight Health and Hub.Health, what's the big problem that you're looking to solve with that business?
Yeah, look, there's a few things that make up our mission statement for our business, right? A huge one is accessibility to care. So it's not only, I think there's been a rapid adoption of digital healthcare services as a result of COVID, but the reality is there's many problems that existed within the healthcare experience well before, the pandemic, kind of pushed more people towards it. Especially in a country like Australia, but also worldwide, there's a huge accessibility problem for people who live in areas where it is difficult to access care. I've seen in our case in Australia, there's so many regional and remote areas where it takes weeks to get access to a doctor. In some cases, you have to travel hours to see one or get access to prescriptions or medication delivery. So, there's the accessibility problem. There's the fragmentation of the healthcare experience, when you're moving through, whether you're seeing a GP or going to a pharmacy or working with multiple GPs or specialists, there's a fragmentation of your healthcare data and the healthcare experience.
Yep.
The other thing is that it's not a, in many cases, it's not a great customer experience. And the reality is, in most of our lives, we're now at the point where technology has gone through this, rapid innovation over the last 5 to 10 years to a point where, on our phones and in our pockets, we can have our food delivered, we can have packages delivered, we can, have a great experience, whether it's even, through things like e-commerce shopping or whatever it might be. And so we've come to a point where, I think healthcare is the last or one of the last industries to actually go through this, innovation and technology adoption that can really improve the experience for the customer or the patient. And so that's ultimately
so slow to adopt new tech. It seems very conservative.
Look, there's multiple reasons, and as we've got more into the industry, you understand why. But it's heavily regulated. It's there are challenges with technology. It's been slow. Hospitals, GP practices, other components of healthcare delivery have been slow to adopt new technologies. And I think, and the flow-on effect of all of that is it means that it is actually quite difficult to pull those all together and create a great experience. So you've got many, old systems and incumbent systems that have kind of also restricted the ability for, the industry to kind of move forward and create a great experience with the patient at the center of it.
Yeah. Oh, it was amazing. Like, just as a little, personal anecdote, I was at the Perth Children's Hospital yesterday with our 1-year-old. Nothing serious. She was in for some tests and things. And, it's a brand new hospital, built only a few years ago. It was going to be, the state of the art kind of facility in the state. And, like the booking and checking in system for different appointments and things is incredible. They have an app where you have like all your appointments in a day and it sends you like reminders, like just as you'd expect the sort of kind of customer experience to be in this day and age. And then, we got in and saw one of the specialists and he needed to write a little referral to go down and have a blood test. And you could see he's got, software there to do it all. And you'd think it would be one of the easiest things, but he had to find the right document, connect it with my daughter's like sort of records, and then print that form so that he could sign it. And it took 5 minutes for the poor guy to get the printer to work. And this is, a guy whose time is extremely in demand. And he spent 5 minutes trying to figure out how to print a form so he could sign it and send us down for a blood test. So there does seem to be this like multiple, like really siloed systems all through the whole health system that just don't talk to each other, and some are way better than others. So,
yeah. And I think that's part of the challenge, right? Because it is, and part of the challenge as a startup in this space as well is going, there's so many problems to solve that you need to narrow your focus and your prioritization into those things where you think you can have an impact, can get growth from, because there's as you said, it's like one part of that experience that you had has gone through the process of embracing technology and creating a great experience for you, but then it falls over as soon as you get to the first weak point in the process and you try to move from one area of care to another.
Yeah.
So, that's a broader problem that's going to exist for quite a few years, ahead of us. But that's the challenge. That's the challenge and the opportunity at the same time, when it comes to digital healthcare and improving the customer, patient, and clinician experience.
Exciting. How did you make the call to get into health? What was the sort of prompt to have a crack at tackling this big behemoth of a problem?
Yeah, so as I was coming through 2019 and getting towards the end of the earn-out process and acquisition with Search Factory, and having a look at which vertical or industry that I wanted to move into next and launch another business. And I tend to look at what's happening in international markets, because Australia is always a few years behind the rest of the world.
Yeah.
And so there's a lot of traction starting to exist in America and the UK around, digital healthcare businesses, remembering this is pre-COVID, obviously. There's businesses like Hims and Hers and Roe in America that were getting a lot of traction by, focusing on these direct-to-patient kind of healthcare models. And so, that is ultimately the driver of, why we had a look at this and said, hey, this is, an opportunity. This is going to get traction here. Surely it's going to make its way into the Australian market, but not only Australia, but many other markets around the world where surely healthcare is going to go through this process. And so that was kind of the starting point. And so then as we were building out the model for the business, myself and my co-founder Matt, we were building out the model and we said, what are the biggest problems we can solve at the start? We started with women's healthcare. So we actually have 4 different brands that sit under Midnight Health now. So we have Hub.health, which you mentioned earlier. We have Stagger.com.au, which focuses on men's health, and we have Yuli.com.au, which focuses on women's health, and Vidality.health, which is our gut health supplement product. And so we launched with Yuli first because we said, we had a look around the space. We said there's a bigger gap in the women's healthcare market. And part of that was, launching Australia's first emergency contraception delivery service, along with, telehealth prescriptions and medication delivery for contraceptive pill, thrush treatments, herpes treatments, things that people would be looking to access discreetly online and fit the model well for people that were going to be early adopters, I suppose. And so while we were building that model, we then also went into the first lockdown for the pandemic. And so it was kind of like the stars were all aligning to, if there's a right time to get stuck into launching a digital healthcare company, this is going to be it. And so that's when we went full steam ahead from there.
What was the technical process you went through to identify that market opportunity and that part of the market wasn't served very well? How did you decide that?
So we did a few things. I mean, we went through, obviously looking at the competition that existed in the digital healthcare space. So there were a couple of male specific brands that had started to pop up in digital health, had only kind of just come to market. There was a couple of more broader, your pilots and Moshes were sort of already in market at that point in time. There wasn't many, if any, really female focused brands in the healthcare space. We also went through the process of, just doing user research and focus groups and having discussions with, women around challenges that they've focused with healthcare and accessing healthcare services. And emergency contraception was one of the things that kept popping up. How bad the experiences of having to go to the pharmacy and getting, ultimately grilled about your sex life in what is probably already a stressful time in your life. And so we started with looking at those really specific problems and going, well, why does it have to exist like that? And as we went through that process, I think, yes, there were some pharmacists we spoke to, who said, no, they need to come in and see me face to face, and this is how it's always been done. But then there were also, many other forward-thinking pharmacists who were very supportive of us, improving access to not only emergency contraception but other treatments as well. And so that gave us enough conviction that look, we could create a model around that and create a business around that. And so it was kind of a combination of many different things. And then when we launched Yuli to market, we got a lot of press because of the fact that it was Australia's first emergency contraception delivery service, among other things. And that kind of gave us a good launch and kickstart to the business.
How did you reach your first customers with Yuli? Was it because of that press, or was there some early kind of customer acquisition tactics you used?
So I mean, the good thing is someone who's come from kind of a marketing and technology background, I guess that's an advantage, I suppose, when it comes to launching an online focused business. So the biggest push we got was from press at the start, but we also started picking up customers just before that by running some paid search campaigns, paid social campaigns, used those to gain some traction, make sure everything worked the way that it was supposed to before we did our push in the press. We didn't want to pick up a whole bunch of press and then have everything fall over because the platform didn't work. So we did a soft launch with search campaigns, things to be able to kind of taper and manage the amount of growth in customers that we got through the business.
Yeah, love it. It's sort of, you can tell when you're onto something that is going to capture people's imagination, when they're already kind of searching for a solution to the problem and they're not quite sure what it is. So there's already a pain point they're trying to solve. And then when you come up with a unique and slightly edgy and almost like out of the box solution to it, and it's PR worthy, then you've got a good combination there of potential product market fit. So it sounds like you hit on that early on. That's really cool, mate. When did you realize, hey, we're onto something, this is getting serious?
Yeah, look, I think that first couple of months when we started picking up traction, and we had a way bigger vision for the business, which is where we're heading. As time moves forward and we keep building out a product roadmap, our whole view and the problems that I mentioned earlier that we're trying to solve, leans into wanting to build a complete healthcare ecosystem that you can access, through a single platform. And so that's where we're heading. But you obviously need those points in time from the start, and each step of the journey that still validate, the journey that you're on or the goal that you're trying to achieve. And so, that first couple of months when we launched our first campaigns to market, we started acquiring our first customers. We had the big push from press when Yuli went to market. As the revenue and the customer volume started growing each month, that's when we kind of started getting more and more confidence in terms of what we were doing as a business, and then ultimately went to market to raise some capital from there.
Can you talk me through a little bit more about the PR process? I mean, how did that work? Did they find you, or were you a little bit proactive with it? And how did you leverage that to its maximum effect?
Yeah, so we worked with a PR agency at the start. So one thing that I, over the years, even prior to Midnight Health launch, one thing that I've just learnt myself with PR is that you do need a hook. You really, in this world of so much viral content and all the rest of it going on around us, is so much noise that you really do need something substantial to help bring you to market. And I actually think that launching Australia's first emergency contraception delivery service, outside of actual customer acquisition and growth, I think that was that as a product was one of the best things we could have had to get to market. So when we went out to, I felt that we had a hook that was able to get enough traction that warranted spending money with a PR agency. You can spend money with a PR agency and have nothing, and they're banging on everyone's doors trying to pitch a story that doesn't really have a story attached to it.
Yeah, it's not good enough just to exist. Like, how are you?
Yeah.
How is it new? How is it novel? Yeah.
Yeah. And as a startup, you can often pay the agency and they'll happily take your money to keep trying to come up with ideas, but you can get to a point where you're also wasting money. So, we worked with an agency. We said, this is what we're launching. We're going to launch on International Women's Day, which is when we actually, launched the brand to market. And so all those things combined set us up to be able to, speak to or get enough positive response from journalists, prior to launch, and have people on embargo ready to go on International Women's Day when we launched the brand. So all of those things pulled together made for a very successful launch.
So you're running a number of different brands, as you said, men's health, gut health, a few other things. What's the strategy? What's the brand strategy there? Why split them up? It's obviously something that we've seen from other, house of brands like Eucalyptus and things in this space. Like, what's the strategy and thinking behind that? Yeah,
so from our perspective, one of the things that was really important for us, obviously, when we first launched the business, was how do we get traction? How are we really targeted with the audience that we're speaking to? Digital healthcare is still in early adoption phase. And so, so we want to create one thing that we can do really well in a digital environment that you can't do in a GP clinic or a pharmacy, is speak to really specific, demographic-led brands. And so when we launched Yuli to market, we're targeting young women, we're talking about sexual health, talking about body positivity. We're building a brand that really resonates with and speaks to the audience that we are targeting with that brand. And so that's how we've brought Yuli to market. And I think that's helped us cut through against your typical healthcare brands or experiences, and that's allowed us to work with ambassadors and influencers who resonate with what we are trying to be as a brand, and that's helped us to gain traction and get people on board. And so we did that with Yuli, and then we've done a similar thing with Stagger, targeting the young male audience. And then as we've launched Hub.Health, we are starting to we reached the point where Yuli and Stagger had gained traction. They're focusing on a really specific audience, but as we move towards our longer term vision of access to this complete health ecosystem where people are managing, multiple chronic conditions, or, accessing and managing accounts for their family members, whether they be older or children, that's where we've now launched the third brand of Hub.Health, so that we can, probably resonates well with where the long-term journey sees us ending up at. So, we'll keep Yuli and Stagger as those niche demographic-led brands, and then, Hub.Health, I think, will continue to become larger over time.
Yeah, love it. Yeah, it's actually really worthwhile for anyone listening or watching to go and have a look. We'll leave the links to the different brands in the show notes, but you can really see the thought that's gone into targeting those different demographics and markets, and see the design outcomes that come from that. It's actually really, it's all the same business, but it's been done really elegantly, Nick. So, well done on that, mate.
Yeah, thanks.
You're also backed by NIB. Recently, they invested around in you guys, which is really cool to see, especially for health in Australia. How did the partnership start with them? How did you get on their radar?
Yeah, so after we launched Yuli as our first brand, as I said, spent a couple of months trying to build some traction and getting momentum, making sure everything worked the way that it was supposed to.
Yep.
And the next step for me was, one of the challenges that I mentioned earlier is, if you start a service-based business, you start at costs are pretty low, right? You can get traction, sell your time, become profitable straight away. If you're trying to tackle a scalable technology business, quite often that comes with needing, a lot of resource in terms of people, technology, marketing, budgets, all the rest of it. So, when we started the business, there was always a view that, we'd be looking to raise capital pretty quickly, but we wanted to build some traction prior to that. So, after we launched the business in February 21, then probably April 21, I was knocking on everybody's door, hassling people on LinkedIn, going to as many events that I could, pitching the business wherever I could, so that we could, ultimately try and raise our first capital round. And we were looking to raise 2.5 million in that first round. Went through, I definitely had over 100, 120, 130 pitches, I think, in meetings with different people. Through that process, ended up speaking with NIB. And then, after a couple of meetings with the NIB team, there was clearly an alignment between our two businesses in terms of where NIB want to go in their future and become, let's say, more of a healthcare provider company alongside an insurer. And then their roadmap and our roadmap were very similar, and we had similar visions to where, digital healthcare could head. And so a big part of our process for raising our first round was not just trying to get money, but finding a company that would be a good strategic partner longer term. And we've certainly found that with them. So in November 21, they made their first investment of $4 million, which was 1.5 million more than we we're actually looking to raise at that point in time. And then they invested another $12 million in July last year as well. So we've had 16 million investment from NIB to date, which has been great. And as I said, it's not only the financial benefit, obviously, that we've needed in terms of resource to keep growing the business, but there's a lot of other benefits come with a strategic like NIB, who've got 1.2 million customers, who have a really great team that we can access, in terms of resourcing and stuff. So they've been a really great partner.
Definitely. That's very cool. The big health insurer here in Western Australia is HBF. And it seems like these big sort of incumbent health insurers are getting to the point where they need to do things a little bit differently to acquire new customers. Like there's a lot of young people dropping off private health. There's a lot of old people who aren't around anymore. They're done with their services with the health insurer. So that they need to find innovative ways to sort of grow their customer base and shift their direction. So it sounds like NIB's done an awesome job getting involved in you guys. That's exciting. And what could possibly be next for the future? I mean, you've established a number of really cool niche brands, plus you've got the Hub.Health, which is driving in that general sort of telehealth sort of space. Partnership with a big insurer. What's the vision for the future?
Yeah, look, I think the broadest version of our vision is that we want to build a complete health ecosystem that will allow you to manage your health and become the starting point for managing your health. So our product roadmap is never ending. The reality is we've probably got, a 10-year product roadmap that we've already mapped out, right? And that's obviously subject to change, but there's no end to that insight. And so, right now we have about 23 conditions that we offer telehealth prescriptions and medication for. We do medical certificates. We do repeat scripts for over 2,000 medications. And so the roadmap from here is integrating pathology specialist and imaging referrals. How do we integrate digital health programs to support medication delivery? introducing new conditions that we're treating, integrating with physical clinic environment, so that if we can't help somebody in a digital healthcare environment, we don't just send them away, but we help them book an appointment and move them into the offline world as necessary. And I think from our perspective, we want to get to the point where when you need to access any healthcare service, you come into our environment first, and then we help you navigate and coordinate the care that you need. And the one thing that we think is really interesting from that, and is a really great opportunity to improve the health of Australians and potentially people globally, is how you use the data to move into preventative health. And so if you're at the point where somebody is using your platform to manage most aspects of their health, how do you take that data and then say, understand whether somebody is showing early signs of a chronic disease that maybe you could prompt them getting tested for, or how you could help them manage something early so that you can get better health outcomes. And I think that's a really great opportunity that's missed in a lot of the current environment, which technology can scale and help us to improve our overall health outcomes as well. So I think as we continue to build out the platform, things like that become really interesting.
And where are you seeing your new customers? How are people finding out about your brands at the moment? Is it lots of different channels? Is there one sort of tactic that's working really well?
Look, it's all quite a lot of different channels. I mean, obviously we're quite digitally led in terms of our marketing strategy. So, paid search, paid social, display, YouTube advertising. We've started our first above the line campaigns actually last month with hub.health, because we've been able to drive enough volume from digital first channels. But we're working, we've now started doing some billboards, some TV catch up. We work with influencers and ambassadors where necessary. So it's ultimately evolved over time, our marketing mix. And so, that's going to continue evolving, as well as partnerships like people like NIB obviously help as well.
Yeah. It's definitely once you get to a certain scale, it starts making sense to do outdoor and some of those traditional things, which might not necessarily be performance based or measurable, but it drives that whole sort of brand awareness. And then when they do come across the digital assets or whatever it is, they're already primed and ready to go and familiar with the brand.
And I think you don't want to lean into that too early, right? I think the brand marketing or above the line is, depending on what your product is, they're typically going to have lower performance, but more long-term benefit. So we sort of have waited a couple of years really to move into those channels.
Yep. And so with the digital platforms, there's a lot of restrictions on things like health advertising. What are some of the lessons you've learned with using those platforms for your customer acquisition?
Oh, there's definitely a lot of challenges in marketing TGA, or working within the TGA guidelines for how you can advertise different services. So there's a lot of work we've had to do in building out pretty comprehensive internal checklists when it comes to TGA advertising guidelines and what we can do with marketing healthcare services. So we've certainly had to work out, how do we talk about certain conditions? How do we market certain conditions? You have things like contraception, for example, can't be marketed in some global markets where a policy team for Instagram or Facebook or Meta create a policy, but then in Australia it can be marketed, but then you still run up against the being banned in platforms or having your accounts taken down and all the rest of it. So there's certainly challenges that we have to navigate when it comes to any kind of marketing of healthcare services.
Yeah, no, it's a good thing in a lot of ways as well, because it stops a lot of those cowboys and those who are considered and do the right thing by the consumer in particular, can still play in that space. So that's good. What's one big piece of advice you have to founders who are looking to get started or looking to grow?
Look, I think one of the things that I think feel that I've gotten better at over time by going out to start multiple businesses is actually really understanding and building a good model to begin with. So sometimes I often meet other founders who have already jumped into building a website, launching a business, all the rest of it, and haven't really worked through their own unit economics or understanding how that business scales, or not factoring in the cost of wages if they got if they did need more staff to start helping them. All of a sudden you might have a 40% margin, but that 40% margin might not actually work if you've got to increase your cost by 60% to actually be able to scale the business and scale the product. So I think there's a lot of really understanding your financials and the modeling for the business before you kick off is is honestly one of the best things you can do, because I think that sets you up to have the best chance at success when you actually kick off. One of the most common things that I see is people not factoring in an appropriate cost per acquisition for a customer. And I think that's people think they're going to acquire a customer for $2 when in reality it might be 100, and that can blow out your projections wildly, to start with. And how are you going to scale the business to hit 100,000 customers? I think you need to start with that in mind.
Such a core concept, which I'm constantly teaching and sharing is the LTV versus CAC, and it's just a disconnect from reality. But it's also understandable. A lot of people haven't run digital marketing agencies before and haven't even run paid pay-per-click ad campaigns or whatever the process is that they're going to acquire customers through. But it does require more than just technical expertise in whatever you're building, or industry expertise, a bit of commercial acumen to understand that you need to acquire customers, you need to find and reach them, give them the right message, change their behavior, and then get them to pay for what you're doing before you can really do anything else. And it is definitely having that holistic view. That's great advice, Nic.
Yeah, and as I said, I mean, I didn't start like that either. It took many a goes and lots of lessons to get to the point where that's how I approach starting a new business now. But I think it just comes over time, right?
Yeah, and I think if people can have that mentality that this whole process is a learning journey, and your job as an entrepreneur is to learn what those puzzle pieces are, and then click them together. You're not going to have all the answers from day one. If we all had the answers from day one, we'll all be billionaires. And
exactly,
you've got to work through it. It's not just like, as you say, it's like an athlete training over years and years.
Yeah, and I think that, and people look at that, there's a journey within the business, and then there's also potential journey with multiple businesses. And so you've got to, if you set out from the outset like that, then you'll approach everything, with a different mentality, I guess.
Can I just ask, are you based in Queensland? Is that right?
That's correct. Yeah.
Yeah, cool. We were over there in Brisbane last year, and just blown away by the tech ecosystem in Brisbane. And I was just hoping that if you could give us a quick overview of like what's happening in Brisbane at the moment. Why is it it just feels like there's very buzzy and very exciting over there at the moment? What is it about Queensland and Brisbane that drives that? Yeah,
look, I think Brisbane punches above its weight in terms of startup scene and the businesses that people are building out here compared to other locations. I think one of the things that I think happens within the Brisbane market is that because it is maybe a smaller market, that creates more of a willingness of people to connect with each other, to share contacts, to help each other try and grow and build. And so there's a lot of great events at places like River City Labs have on a regular basis, and other startup hubs within Brisbane that are trying to drive the startup scene forward, and people that have had success that are willing to share their time with people and mentor and all the rest of it. And I think that's all leading to a pretty cool environment that's sort of popped up in Brisbane for startups and people that are trying to go on that journey themselves. Then there's even support from, like, last year we were accepted into a medtech accelerator that was created by the Brisbane Economic Development Agency. And so that was a program that we went on for 8 weeks. And then as part of that, went to pitch in San Francisco at the Resi conference that was on in JP Morgan Health Week. And so you do have support from local council and government, that's also jumping in alongside everybody else in the ecosystem who's trying to help each other out and hoping to see success. So it's creating a really good environment we got here.
Yeah, very cool. Now, I hope that Perth can, we're definitely moving in that direction. And I think Brisbane, I think Queensland and West Australia have a lot of similarities in terms of just the entrepreneurial spirit, and a lot of people are either connected or have some connection to the resources sector as well. So yeah, if Perth can be like Brisbane in 5 or 10 years, it'd be very exciting. But with, very same, like very small, kind of close-knit community, help each other out, but it'd be great to see it grow. Yeah, that's cool. If you haven't been to Brisbane, anyone out there listening, I reckon it's one of the best cities in Australia. It's very cool. Show and tell time, Nic. Favorite tool, device, toy, something which is helping you in your life, which you couldn't live without?
I mean, look, from a business perspective, I find that Slack is a fantastic tool. I mean, a lot of people are on Slack now, but I've found that a transition from using less emails and using more Slack has actually been a good transition within our business. It makes things more efficient, allows you to tick things off quickly. And I find that when I've got a super busy calendar throughout the day, that my emails end up getting left for a while, and I jump on Slack first, and I find that it's helping to tick things off and give people quick answers. So yeah, that's probably what I'd pick right now as a tool that I'm enjoying.
Yeah, Slack's great. Just couldn't live without it. Any plugins or anything in particular that you have that you use in Slack that helps?
Slack, not so much. I mean, obviously connected. We use Google Workspace for everything, so we've got everything in Google connected. I thoroughly enjoyed the Giphy plugin in Slack for a good time.
We just connected the ChatGPT API. So like there's another little sort of member of our Slack channel called ChatGPT.
Oh, yeah.
we can add that person, and then they'll respond. It just pings the API.
Yeah.
But it helps to try to sort of build the habit as a team of leaning on some of that technology, and just remember that actually, you don't need to write everything. You don't need to write a whole bloody blog post from scratch. You can get 80% of the way there and then polish it up from there.
Yeah.
So that's been handy in our little Slack channel as a team. Well, Nic, if anyone's interested in learning more about Midnight Health or any of your businesses or brands, what's the final plug, mate? What do you want them to do?
Oh, look, I mean, you can jump on midnight.health, which is our corporate website, probably due for an update, like I think most people's corporate websites are. But otherwise, jump on LinkedIn, follow Midnight Health on LinkedIn, follow me, connect with me on LinkedIn, usually trying to share as many updates as we can. So yeah, really keen for people to follow our journey, and hopefully we continue having good news and success, and we can share that with you all.
Well, I really hope you do, man. And yeah, again, like it's been awesome learning about what you've achieved in a very short amount of time, and doing it, in a direction which is just going to be so helpful to so many people's lives, and just the broader sort of health system in Australia. As we said, it needs. There's so much room for improvement. So thank you for everything that you're doing. Thank you for sharing your story on Weird Growth today, and yeah, continued success, mate. Thank you very much for being on the show.
Yeah, thanks for having me. Been a great chat.
It has, yeah, appreciate it. And thank you all for listening. If you enjoyed this episode, please do subscribe on Apple Podcasts or jump on YouTube, leave a review. If you're watching on Spotify, or listening on Spotify, there's a way to rate us as well. I'd really appreciate all your support. But until the next episode on Weird Growth, I'm Cam Sinclair. Thank you, Nic. Bye-bye.